Good afternoon, everyone, and welcome to day one of the IESPI meeting. And just to make sure you're in the right place, this is the session, one of the COVID-related sessions, and this session in particular will focus on the impact of the pandemic on early childhood programs and early childhood research. So as we all know, the global pandemic exposed the existing inequities in the early care and education system, specifically disparities in the early childhood workforce, as well as disparities in terms of the quality of care that's available to children, families, and from diverse communities and diverse backgrounds. And so the purpose of this session is to really have a discussion about that, to really try to understand how far-reaching those impacts have been on the communities served in early care and education settings, and to also talk about the impact on research, and then to really think about, okay, where do we go from here and what can we do to address those impacts on the early care and education system. So we have put together a great panel of early childhood experts who I will ask to introduce themselves in a few minutes, and I should introduce myself. I just assume people know who I am. So Caroline Ebanks, I'm one of the program officers at the Institute of Education Sciences in the National Center for Education Research. I am responsible for managing our NCER early childhood research grants. And so, as I said, this session this afternoon is focusing on COVID impact. And it's a 90-minute interactive session. There are no presentations. So for those of you looking for PowerPoints, we will not have any, but what I'm hoping we will have is a really exciting and engaging and interesting discussion that will help to inform what you do as researchers moving forward. And so the session is really structured around three core segments. In the first segment, the panelists will talk about the state of the field, and we will lead with the people. So really focusing on the impact of the pandemic on children, on families, and on early childhood programs. And then the panel of presenters, the panelists include several currently funded IES grantees who will also talk about the impact of the pandemic on their IES-funded research projects. And then in the second segment, we will really then talk about, well, what are the implications? So given the current context and the circumstances, what do we need to consider as we move forward, both with early childhood practices and programs, as well as the research? And then the final segment will focus on recommendations. So what do we need to think about in terms of the role of research in addressing the pandemic, and to think about current and future research and focus on recommendations? And the panelists will share their thoughts and recommendations. And we have set aside some time at the end for discussion and Q&A with all of you. So if you have questions as we're going along, you can always include information in the chat, and then there'll also be an opportunity for you to raise your hand and ask the question at the end. So with that, I will ask each of our panelists to introduce themselves and just your name and affiliation, and then we will jump right into the first segment of the session.
I'll go first. I'm April Crawford. I'm with the Children's Learning Institute at the University of Texas Health Science Center in Houston.
I'll go second so that we're in alphabetical order. My name is Stephanie Curitin. I'm an associate professor at Boston University. Happy to be here.
I'll go third. Hi, everyone. Oh, sorry, Kelly.
Oh, Andy.
Thank you. My name is Andy Mashburn. I'm a professor of applied developmental psychology at Portland State University.
Hi, everyone. I'm Kelly Pertell, and I'm an associate professor at Ohio State University.
Jason Sachs, Boston Public Schools, oversee early childhood programming in UPK and in the Boston Public Schools.
Hi, good afternoon. I'm Rebecca Shear. I am an associate professor at the University of Miami.
Hi, everybody. I'm Amanda Williford. I'm a professor and an associate director of the Center for Advanced Study of Teaching and Learning at the School of Education and Human Development at the University of Virginia.
Thank you all. And as I said, we'll just launch into the first segment, really trying to get a better sense of the state of the field. So with that in mind, this question is for all of the panelists. I would just like you to share a little bit about how you think the pandemic has impacted families and children and communities, early childhood educators and early childhood programs. And you can address some of those groups or all of them in the programs, but would love to just hear your thoughts in thinking about your own work, but also just a larger context locally and nationally, what that looks like in terms of impact on those communities. Who would like to start, or do I need to call on someone to go first?
I'm happy to start. When I was reflecting on this question, I think, and there's so many where I was like, well, everyone will think that. It's kind of like, duh, of course, but just the instability and unpredictability of care for kids, both kind of the substantial kind of turnover. I know like some of my research that I was doing kind of stopped, and then some research that we did kept going. And one of the things in one of the studies that we kept track on was just like the day-to-day turnover in a set of like 112 classrooms. And it was astounding, even when, teachers weren't leaving the program, which was happening at substantial rates, just the day-to-day in the classroom, who was in the classroom, and what that means for both educators and parents in terms of attachment with young children, and just like who is interacting with young kids and what that means for children, and the kind of stress on that for both educators and parents and kids. And more, I think the instability is certainly one part of it, but the unpredictability of it within the pandemic, I think, is also just a different kind of stressor, and how that unpredictability really affects the adults in young kids' lives, and how that will then, have an effect on young children in ways that I don't think we're seeing now, but we will kind of see as children develop. So that's just one thing that I kind of have been thinking about.
Great points, Amanda. Thank you. Other panelists, love to hear your thoughts.
Yeah, I can add on to that. I think it piggybacks off of what Amanda just said. I mean, I feel like the developmental processes for the young kids, if we're really thinking about it from their perspective, have been completely disrupted by COVID. And certainly the attachments that you form with your teachers, the opportunities to play with your peers. I mean, those things, just given the inconsistencies in care and turnover and absenteeism, are harder to establish for these young kids. I also think about just the role of one's mouth in early childhood development. And as we're walking around with masks, how difficult it might be to learn some of these basic emotion skills, the recognizing and understanding and labeling emotions probably is disrupted because of this. I also think about language development and how much of sort of letter sounds comes from seeing the mouth, or even just having somebody put their finger on the mouth to be able to notice how to make the b or the. And so I think some of the processes of learning have been disrupted from the kids' perspective. From the early childhood workforce perspective, we were in the first year of our efficacy study, and so spring hit and we weren't able to collect the data for student outcomes, but we were quick to ask questions about stress and anxiety and depression of teachers. And we asked some of these same questions at the beginning of the year as well, and we found remarkable increases in anxiety and depression, as you would expect, and it's an efficacy study, and it hit the treatment and control groups equally hard. But things like a 2/3 of a standard deviation increase in anxiety from fall to spring. Now, some of that might be naturally baked into the course of a school year, but not to that extent. And a 1 standard deviation increase in depression, self-reported depression from fall to spring. So this is where I feel like it's certainly hitting our early childhood workforce in terms of their stress and anxiety and mental health and well-being.
I can follow up from there. I think I agree with everything Amanda and Andy said, and I've seen the same thing here in Ohio. I also think that we've just seen a lot of problems that were existing pre-pandemic exacerbated, particularly thinking about the workforce. Being an ECE teacher has always been a hard job with low pay, and turnover has been an issue that we've been talking about for years now. And certainly that has magnified during the pandemic. And then we've seen similar things show up for children in our data. So it was the kids who were having social emotional problems before the pandemic that are most impacted by their parents' stress and things like that. And so thinking about the unequal ways in which the pandemic is impacting kids, I think is something important to keep in mind moving forward.
Yeah, so I'll add to those thoughts in terms of thinking about how the pandemic has affected children in a variety of ways, both sort of at that individual level and then even on when we think about sort of the ecosystem level as well. So one of the ways that we often talk about how in the education field, how the pandemic has affected things is through children's learning and what researchers are now calling this unfinished learning. And the whole idea that we found that COVID has resulted in our K through 12 sort of students a loss of learning that's about 5 months behind in math, 4 months behind in reading, and that this sort of unfinished learning is especially hard on economically disadvantaged students, most of whom are racially marginalized learners, in that the pandemic has like widened sort of these learning gaps that were already existing. And the gaps have been widened because of the disparities in resources, like the access to sort of the resources that were needed for online learning, you know, last year, the disparities that were evident last year in terms of which districts were going to go back to in-person learning versus which districts, you know, were not. And I also think, you know, along these lines that what the pandemic has done for the financing of our larger early childhood system overall, and that a large group of children, most of whom are from the upper end of our income spectrum, have actually left our public school system in lieu of attending private school. And so we're resulted in a drop in numbers. It's the opposite that I want to say it. I mean, it's the same true, but what I want to say is so that we have a result, and it's resulted in a greater number of kids now being enrolled in private schools, which has negative consequences for our public schools, given the way our funding model goes for public schools. And I think that that is critically important for us to think about as scholars, and it's something that we need to start to watch, and it's something that we need to start to understand what the long-term impacts will be in relation to that. I also think that, as someone was saying, our workforce has been hit like incredibly hard with the centers closing, which results in loss of jobs and a loss of childcare slots for families. So now we have families who can't find the care that they need so that they can work. And we also have a workforce that was already underpaid now being unemployed and without jobs. And then what that sort of means for the larger sort of body of our workforce in general, right? And then I guess lastly, what I would say too is just to really thinking about the diversity of our workforce, again, thinking about the family childcare providers and sort of that whole sector of our workforce, and how that segment of our workforce has really been able to step up and show how essential they are in terms of this pandemic, because a lot of our family childcare homes were actually able to remain open even when the centers had closed. And but at the same time, them staying open put these family childcare workers in even more need financially and policy-wise and professional development-wise for supports that they need. So it was already a workforce that had a grave amount of needs, right? And now, because they were stressed and staying open during the pandemic and sort of really taking up a lot of the slack, they're even more in need. And that's just critically important, because as we think about our workforce, we have to understand that our workforce is made up of racially, ethnically, and culturally diverse women, right? And so these hits that we've taken to the workforce is directly targeting sort of that population of people in our workforce. And so I think that these leave open for like additional questions for us to answer, you know, in the future, and things for us to like think about.
I'll go, well, after you. I'll go last. It's fine.
I was just going to say, great points. Go for it, Jason.
All right, so I'll give you an institutional perspective because I think sitting where I sit, it's clear public schools and for the most part, community-based programs had no preparation or understanding in what they were doing in the middle of a pandemic. We're designed for kids to enter in and be taught through relationships and materials and to some degree scope and sequence curriculum. Along comes a pandemic and children don't show up, and now we're supposed to teach in a remote platform. And I don't think there was any research or any kind of guidance on exactly how to do this. We had a curriculum, and so we immediately tried to figure out how to do it remote. I think we immediately used a platform that was accessible for families. We became family dependent, which the public schools are not good at, and so we had to build relationships with families because they had to download or connect up a lot of the instructional materials. There was a huge gap between who accessed and who did not. Even though we provided computers, you can see that about 40% of the kids that, were not engaged or enrolled. And that seemed to be acceptable, which is the other thing is like, what are the expectations about people being connected? What are the expectations about teachers teaching? Is it at the school level? Is it at the district level? Who's in charge? And there was a lot of just schools not prepared at that point to figure out those things. So we had to invent all of this. So I think, that was last year when we were remote. This year, we were back in school, but now because of surges, we're missing half the kids again. And we're missing a large chunk of teachers. And so it's sort of now, what are the expectations? What are we trying to teach? One teacher said to me the other day, if I'd have known I was only getting 4 months as opposed to 8 months, I would have taught my year differently. And if I was in a classroom of 12 kids as opposed to 22, I might have done things differently. So I think, there's lessons learned, but mostly how underprepared we were for this. And that the systems are not designed well. And so I think future research is, how next time we're in this situation, what do we need to do better? What have we learned? And then I just think everything, you all mentioned that there is huge disparities, and this just shine the light on it even more. So I'll leave it at that.
Thank you, Jason. So Rebecca, or I'm trying to remember, April, if you talked already, if either one of you want to add anything. Rebecca, do you want to add anything?
I don't think so. I mean, I think that what y'all said already is really touches on what I would have said. And I think that there's the disparities too across systems, and not just, like as Stephanie was saying, across the family childcare system, across the public school systems that are providing early childhood education, but also the community-based centers and the closures. I think all of that is just chaotic for children, families, and the workforce in general. So I think you all touched upon that, and certainly here in Miami we have such a diversity of cultural, language, immigrant backgrounds from providers to families, that there's just I think no one really knows what to do and how to solve it. I mean, I think what Jason's saying is really, really true. It's just kind of chaos, and the tools and ways in which we try to address some of these issues before, we just don't know I think people just don't know how to make it better, like how to fix it. I'm frozen, but go ahead, April, if you wanted to say something.
Yeah, I agree with everything everyone is saying, obviously. And I think, maybe by extension, I would say I think we rightfully were really focused on burnout, stress, lack of preparedness, like the uncertainty and the negative sides. But I've also found a little, glimmer of hope in a lot of it. We've done a fair amount of survey work with our state workforce in Texas. And, what's fascinating is, yes, they report higher anxiety, more stress. They're wearing lots of hats. They're working more hours. They're in childcare. They're much less certain about job security. in public schools. They seem much more concerned about not job security necessarily, but about the kind of transition to more remote engagement with students and with families. So like different worries, but what's always fascinating is to read comments from all of these respondents, and they're still really dedicated professionals. You know, they're going above and beyond. They're helping families with things they haven't helped with in the past. You know, so I think it's my hope is that we kind of get through some of this, and there's seems to be increased attention and focus even in, you know, media broadly around sort of the challenges in the early childhood system and in childcare. And my hope is that we're kind of like shining a light in a way that it kind of catalyzes movement for this workforce.
Thank you all for everything you've shared. I mean, you've touched on all of the things. I thought it was really important to start this session this way. I mean, this is the IES Research PI Meeting Conference, but I think it's really important for us to keep at the very center the children who are being served in early childhood programs, their families, the educators, and you've all touched on all of that, both, you know, from the individual or level in terms of the stress for the teachers, the burnout, the teacher turnover, all of those things, the uncertainty, to things like, you know, the attachment between the parent and the child, and the social emotional challenges that are being faced, all the way up to the systems level, and the things that Jason and others have mentioned related to, and Stephanie as well, sort of we have issues related to salary and compensation when we think about, you know, a workforce primarily of women and a lot of women of color who are underpaid. We have, you know, issues in terms of access to resources and who got what they needed in terms of learning opportunities during the remote learning situation. So I think it's important to keep all of those things at the center. Over the past 2 years, I've spent a lot of my time, you know, because of my daily job, talking to folks about their research. And I have often been struck by, you know, yes, the research is important. That's always been my message to folks, is that yes, we funded you to do work, but remember that we're working with other human beings. And so being able to start this conversation that we're having this afternoon by remembering what our field looks like right now in terms of early childhood education and the impact this has had on the individuals and the communities and the system itself as a whole, to keep that at the center, even as we think about, okay, what do we need to do about the research, right, to keep this at the center. So I appreciate everything you've all shared, and to all of the folks listening in, I'll hold on to everything. We've just kind of, you know, laid a foundation in terms of this is what things look like. I'm now going to ask the panelists who are current IES grantees to talk a little bit about the specific impact on your project. So I've said, yes, we need to center the people, but we're also going to talk about the research as well and the impact on the research, which involves all of those people. And so when you talk about the impact on your specific project, I think it would be helpful to let folks know whether or not you're able to continue your work this academic year or last year, 2020 to 2021, or 2021 now into 2022, or whether, you know, so whether your project's on hold or not, as you share just a little bit about what things are looking like for your individual research projects.
I'm happy to start. So we have 2 active early learning programs and policies projects that I'm PI for. One of them is a development project, and it's been moving largely now as planned. We're fortunate there's a lot of in-house work happening this year, and we have enough partners who are able to give us access to schools to film and do things like that, but it's sort of on track. We also have an efficacy study that is on pause again this year. And this is a project that's really focused on kind of shifting professional development choices to teachers and giving them more flexibility and autonomy to choose topics that are of interest and need to them, you know, for them. There's a continuous improvement kind of driver behind it all, where you're kind of setting goals and practicing and reflecting. And then there's engagement in remote kinds of support, like professional learning communities or remote coaching. And then some of our participants are in a self-study condition. So what was kind of interesting for us at the start of the pandemic is initially, you know, before we really had very much knowledge about what was going to unfold, we felt like, wow, okay, well, we're kind of lucky. We have a fully remote intervention. Everything's online. We are well trained for this. We can kind of keep things moving, and then it became clear pretty quickly based on the dialogue and conversations with our teachers in our PLC meetings and in our remote coaching sessions that teachers have much bigger things on their mind right now than, their own continuous improvement and strengthening these kind of self-determined areas of practice. So it became clear quickly that, schools were still open, but the focus of our conversations were not sort of in the lane we had planned to be in. They were very happy to continue having coaching calls and PLCs. I think they actually really valued that sense of, connection and community with the mentors and their peers in the PLC groups. So we kept going for a little while, even though the content, was kind of shifting a bit. And then school started to close, and it became really clear that even if we could pull off our intervention remotely and try to have some topic focus, we weren't going to be able to get in and assess kids. So our post-test was going to be, deeply impacted. And in fact, it was canceled as all of our schools closed in Texas. So moving into our next year, I think for a little bit, we actually thought we can still probably make this work. We have a lot of amazing partners. The kids are going to be back. And then through a lot of kind of thinking, reflecting, and talking with Caroline, we realized this is not going to be a good year to try to get this done. And really, we opted even to stay on pause this year. It's a project that requires teachers to have kind of the headspace for thinking about their professional learning and growth. And this just, does not feel like the right time to kind of place that on teachers. So we're paused again this year. We're kind of in the process of thinking about what it looks like to restart. The plan is to restart for next year. So we've been looking at maybe some small modifications to things, where we might load in some additional professional development topics that seem more in alignment with the concerns and needs that we've heard from teachers this year. So we're kind of working through all of those logistics now, but still on pause.
Kelly, Andy, we'll keep going with the folks who are on pause if either one of you want to go next.
I'm happy to jump in right now. So we are doing an efficacy trial up here in Portland, and we were in the first cohort in fall of 2019, and it was a huge success. We recruited 38 teachers, we randomized them, we did baseline assessments, we had no missing data at the teacher level, we had 280 direct assessments of kids, teacher reports of kids. We did everything exactly as proposed, except for maybe 5 fewer classrooms than what we had said. And so we, come spring, we're still sort of at the 12th week of a 15-week implementation of the intervention. And that Friday, March 13th is when, it all sort of went away. So we, basically we were left without being able to answer our primary research question, or any research question for that matter, without having any post-test data. We, tried to make some changes to our research, to our implementation. We shifted our intervention and our professional learning communities to an online space. We tried to add more survey data from teachers at the end of the year about the kids that they could make reports on. But basically we had to cancel the in-person assessments, cancel the observations. And even we were relying upon our statewide kindergarten readiness assessment in Oregon as being our sort of long-term outcome at the beginning of kindergarten. How are these kids doing in their social, regulatory, academic skills? And Oregon decided, rightfully so, to cancel that because at that point, school was completely remote at the beginning of that follow-up year. So we have been on pause since that March 13th. We sort of, this past summer, we're sort of feeling a bit of optimism, like maybe we could go recruit, maybe we could get these schools and classrooms and teachers to agree. And then Delta came. And so we were just like, okay, it never even got to the point where it felt right to reach out because in Oregon and in Portland in particular, we've been very cautious, and our governor of Oregon has been very cautious with regard to mask mandates and vaccine policies and indoor regulations and outdoor regulations. And so never once did it feel like I need to go ask people if they can do a research study right now. And so that's where we sit right now. I mean, sort of the hope is that we will be able to move forward this next fall. Of course, I mean, I feel like I've lost a lot of optimism with regard to the future, but I'm feeling a little bit more that this could be a likely scenario. But I'm also just concerned about how we'll be able to answer those questions at review panel in 2017 or something said, yeah, we like what you're doing here, when COVID wasn't even a thing on their radar. And so, I'm worried about how we're doing classroom observations, direct assessments of kids, when this is really up to the parents to provide consent, and the teachers to provide consent, and the centers to allow us to come in and do this. I worry about direct assessments, and I worry about how we're going to get long-term data, given that the state made a good decision to stop doing this one-on-one direct assessment. And so right now, we're approaching the work as honoring our commitments to those teachers who we have worked with. So the waitlist control teachers we've been working with, once they came back, and many of them didn't come back, but once they came back to their classrooms and wanted support, we offered that. Even our treatment group teachers from that first year, we kind of left without the sort of like completion or feeling like we'd done what we came to do. And so we offered support for those teachers as well. But right now we're just kind of waiting for the world to return back to pre-COVID. And I think that's just, I think at this point, we've waited too long, and we need to go out and do the implementation, because the field needs this. It's a social emotional learning program for kids. The kids need this, the teachers need this. And so I'm looking forward to a time and place when we can stop, and this is for myself, stop waiting for things to go back to the normal, and just sort of recognizing that we're going to have to move forward with research and implementation under the current context, which may change, which will change, because that's the only thing I know to be true, is that change is happening month after month.
Yeah, a lot of my experience mirrors some of the things that Andy just talked about. So I was in the first cohort of an exploration study when COVID hit. And so we also did not get any post-test data, and really weren't able to use data that year. And we've not gone back in to collect data since. And the focus of the project is really on age composition in classrooms, and how children's experiences vary by their own age within these different classrooms, and how teachers' practices and peer relationships shape the learning and development that's going on. And so we also had extensive conversations this past summer about whether or not we wanted to go back in the classroom this fall. Things are a little bit more lax here in Ohio, and a lot of our partners were ready and willing to go back in, although similar to what you said, Andy, many of our teachers had turned over, so we would be going back to work with new teachers. And there was a lot of safety concerns related to Delta that we were parsing through, but we also were really grappling with that question of, can we answer our original research questions? And at the time, I thought no, because many of our programs were still operating under specific pandemic funds that required reduced classroom sizes. We knew that quarantine and isolation procedures meant that there would be a lot of variation in terms of which kids were in the classroom day to day. And I think I was operating under this wait till we get back to normal perspective. In the months that have followed, I've come to think a lot more along the lines of what Andy is discussing, which is we're just moving to a new normal, and we need to adjust both our research questions and our research data collection strategies to really align with that new perspective. And so I'm very cautiously optimistic that we'll go back into the field this summer, but how we're thinking about our questions and how we're going to answer those questions is an evolving conversation that we're having. The one other thing I will say is I'm a part of an efficacy trial that paused last year and went back into the field this year. And so it's focused on supporting kids during the transition to kindergarten and really engaging families in that. And so right now we're dealing with switching to virtual and things like that. But one of the things that was really profound was that when we went to recruit new classrooms last summer and last fall, we just had tremendous buy-in from districts and teachers, because they really recognized that the kids are in need of new supports and new things, and really wanted to help kids kind of succeed as they're entering school in the context of everything that they've experienced the past year or two.
Thank you, Kelly. Amanda and Rebecca, I don't know if you want to say anything about your project.
I will let Rebecca say most of what has been kind of happening, but we did not pause our efficacy trial. We were just through the design, just by chance, we happened to be in a planning year during last school year. So during the first year of COVID. So we were like, well, our plan will be to kind of start the efficacy trial in the second year. And so we kind of did some planning, and we were able to do that within the context of COVID. And then like you said, Kelly, I think, and Rebecca, you can speak to this, just like your kind of strong partnership with Head Start in Miami, they were really strong partners from the beginning of really wanting to work with us on this early childhood mental health consultation. And the need was so great that I do feel like we felt pressured, like if we can do this, that our partners want us to do it. And so we worked really hard, and and our teams have been amazingly flexible in trying to figure out how to adapt all kinds of aspects of how we would implement the trial. And we were very lucky because the early childhood mental health consultation itself was video based. So there were just lots of things that we could make small tweaks to that really didn't change the intervention itself. I would say data collection has been a beast this year, to say the least. And I'll turn it over to Rebecca because she is leading the kind of collection of the data.
Mm-hmm.
And yeah.
Yeah, so the way that we've kind of, so Amanda, so this is a labor of love, and Amanda and I and Jason Downer have been working together on this intervention now for a long time. But Amanda's team has been leading the intervention implementation, and here in Miami, we've been responsible for the evaluation side. So I guess, we were really fortunate, as Amanda was saying in the beginning, just to have that planning year ahead of time. But during that year, we had a lot of discussions with our community partners, and really, we kind of, they really were like, you have to stay, you have to implement this. This is really important. They had really co-created this program with us over the past 5 to 6 years through a goal 2, and now testing it through an efficacy trial. So they were really with us, and they wanted us to stay. And even I would explain, well, this means that we have to, it's a randomized control trial. We have to randomize, and we have to collect pre and post data. They wanted us to stay. So I think that was part of the commitment that we felt, that we, under whatever conditions we could do this safely, we really wanted to honor our commitments to the program and move forward. But in the spring of that year, of the first planning year, we went in and we recruited. We had meetings with many of the schools, obviously virtually most of the time, although Miami in Florida is a little more flexible and open than other states in response to COVID. So a lot of the schools were open, obviously with a lot of restrictions. But we were able to recruit over 130 teachers in that spring across many different schools. We had a wait list and started, consenting families and children. But now come the fall, we lost, almost half of those teachers are, either left the program, moved to a different program, or no longer teaching. So we had to wait and adjust our randomization when we were going to do that, so that we didn't, look like we had 50% of attrition before we even started the trial. So, it just delays progress, not perfection. We've had to adjust our protocol for data collection, just in terms of, doing direct assessments of children that we had anticipated being able to do executive functioning tests, and we just didn't feel safe doing that. We've been really slow because we could only have one person in a classroom, and we were allowed to go in classrooms to do observation. So technology has been an issue. Anyone tried to use virtual coobies and going in and setting up observations in classrooms. It was miking teachers virtually, everything. So, lots of gray hair, and I'm frozen, but perfect time to be frozen. So I don't know. I think, thinking future, we're thinking of going into the next set of questions, but I wish there was some way where we could capitalize on data and measures that were already being collected within programs, and that those would be in some ways reliable and valid enough to be able to capture important constructs that are in our theory of change and in our outcomes that, you know, that we could strengthen the infrastructure of some of the program measures that are being collected, rather than I mean, I think that's one solution potentially to going in and doing these hardcore direct assessments. But anyways, I can talk a lot more about the issue, but I want to give it over to someone else. And Amanda, I don't know if you want to add anything else to that. I know implementation's been difficult too.
Yeah, no, and just the idea that, you know, especially on the social emotional side, even if we can collect the data, and we can talk more about this later, what the data mean for these contextually embedded skills. And I think we always want to like compare our data, but what the means are in standard deviation of like what a teacher report measure of social skills means in the context of a classroom where they're reporting where children have tape around them on the floor that shows them where they have to be and their masks on, that really constrains, and like everyone has to have their own materials now for COVID safety. So I think even getting the data, interpreting the data, and if we have an intervention and control group, that helps a little bit. But I just think like even understanding what our data mean as the context shifts is just another after we even, you know, deal with all the headaches of getting the data, then understanding what that data mean for us.
Thank you all. So I think we've spent a little bit longer than we originally thought of on this section of the discussion, but I think it's been really helpful. I know hopefully it's been helpful to all of the researchers who are attendees who are listening in on this conversation. And just so folks know, before we move to the next set of questions, if you have comments or questions that you want us to address, please put those in the chat. We will hopefully have at least 15 minutes or so towards the end of this panel discussion for more audience input and participation. But hopefully this discussion so far has been helpful and informative to you. So we're going to shift now. So kind of, you know, we have a good sense of what the challenges have been in terms of the early childhood workforce, the children and the families who are being served in early childhood programs, what the challenges have been for some of these research studies. So given that the current context and the realities, to just take a few minutes to think about sort of what are the things to consider. So we're going to talk about, you know, future research and recommendations in a few minutes. But before we get to that, to just really think in light of everything you've all said and some of the concerns that have been raised around teacher mental health issues or children's social emotional skills, or just even the hesitancy or the willingness of parents or programs to participate in research and a lot of other structural issues that are challenges that are in place. What are some things that you think need to be considered moving forward in terms of how you approach or work with early childhood programs and children and their parents, and also how you think about the work that needs to be done moving forward? And don't all speak at once.
I think one of the big challenges and the things that, you know, one of the things that we're really trying to work through in our service programs that have continued to move forward during the pandemic is figuring out who needs what, you know. So we know that there's like high level of burnout for teachers, high stress, but it's not universal. You know, some teachers are still ready to, I don't know if they're compartmentalizing or if they just cope with stress differently, but they're still coming to work every day, ready to grow, ready to do their work. And others, the teacher right next door, may be in a very different place. So figuring out if we have sort of opportunities for people to participate in more, you know, in, let's say, a targeted intervention for supporting adult social emotional learning. You know, we've been, you know, exploring how we can start offering that to our staff. Early in the pandemic, we required everybody to attend. And honestly, we got some feedback that not everybody wants to attend, you know, so it's, and I think the same thing is true for children. You know, when I observe in classrooms in a school that we operate, you know, you see some kids who they're playing, talking, communicating, and moving through the classroom as if we're not in the middle of a pandemic. So it's like, how do we get better at, both in our research and in just our general intervention and support, how do we get better at really identifying who needs what and adapting to that, so that we're not sort of painting with a broad brush and bringing in, from a research perspective, it comes down in part to an efficiency kind of case. If you need to tailor and adapt an intervention based on need, that's what the goal should be, not to sort of blanket everybody in a classroom or in a context with the exact same interventions and supports. So that's one of the challenges I've been trying to work through, is how do we get better at sensing who needs what and matching to those needs.
Something related to what Kelly said, I think, or but this around kind of like, or maybe it was April, like around like what we're doing just wasn't in the same lane as what teachers needed. Is I do think like one of the implications is the consideration of how much of what we are doing, and in particular, I think in terms of research, but some of the other, at least for me, and some of the other research practice partnership work, is like, how much are we just adding an additional burden or an additional trauma to our early childhood education field? So really this like match of like, where are what we were interested in before the pandemic sits within the hierarchy of need, and where do kind of you really kind of think about and consider like this, whether or not this is fair and appropriate to keep kind of pushing on kind of in this moment, and where do you shift, and kind of how is it that like, and I don't think our academic institutions are very good about the kind of blending of kind of research and service, but where are there kind of research methods that we are can use, but kind of use those in the focus of service of what the early childhood field means, instead of kind of like, what is it that we would like to know about with our own kind of research interests.
So I think this is a good area for me to piggyback on, because when I approach this question of like, well, what do we do, now, it really made me think about, there's a real opportunity now for us to open up our minds and open up our research practices to really start to think about racism, racial stress, racial trauma. And my colleagues and I in the Riser Network, we talk about how we're really facing sort of these two twin pandemics at this time point. And one, of course, is the COVID pandemic, and the other pandemic is racism. And, even though racism has always existed, what has happened during COVID is that it's changed the way society now views racism, because it's so much more apparent in terms of how racism is institutionalized within society. And in the summer of 2020, the vast majority of people were like incredibly sort of like moved by the impact of racism, and they really felt compelled to act. And at that point, the positive aspect is that we saw our education workforce was really emotionally open and ready to think about how to engage in their own issues around bias, and to really start to learn about ways of how to walk students through this developmental process, as well. But unfortunately, time is passing, and I can see society sort of reverting back to the status quo. But this is why it's so important for us as researchers and for the funding community to continue to talk about these issues, and to continue to keep this window of opportunity for reflection and restructuring of our early childhood system open. And so, I think one of the things we think about is just really the need to reflect on how our early childhood system is racist in its structural underpinnings and in its financing. I'm working with some colleagues now with Childcare Aware. We are producing a brief to talk about this very issue. And I think that, along similar lines, we need to think about how COVID is really providing an opportunity to expand our research questions and to modify how we think about professional development. So one of the ways in terms of modifying our research questions is thinking about child outcomes and how important it is in this time to really start to conceptualize like racial identity as a social emotional skill and include measures that look at racial stress and trauma so that we can really understand how children experience this and how they're experiencing at the pandemic, but also, in their lives all the time. And then also thinking about how we design our research questions to look at sort of those proximal variables related to these things as well, such as parents' employment and their household financial situations, because many families have experienced a loss of income and loss of jobs during the pandemic, especially people that are on that lower end of the income range. And then I guess the last thing that I would just say about sort of revisioning and like what we can do now and going forward is that this is also an opportune time where our field is ripe for building the workforce's capacity to engage in this professional learning around anti-racist teaching practices and family engagement. And it's now time for our public funders to really become dedicated to this and start to dedicate resources toward this and start to fund sort of this as a topical area, but also to start to fund some of the scholars who've been doing this work for decades, around this. And so I think that this is a great opportunity for us to think about what do we do now. And this is a huge moment in time for us to think about how we actually change the world going forward.
Excellent point, Stephanie, that we will revisit. Anyone else want to chime in on this before I dig a little deeper into some of the things Stephanie's shared?
I can just add a little bit. I just want to say, and it's funny because when you asked that question, I was like, solve inequities. So I was, but I think actually Stephanie got it a lot better. I just want to remind people that we weren't doing things particularly well before the pandemic. So I'm nervous about going and inventing 20 new things when we really should fix that which was not fixed before. Again, how did we do better? How do we improve the quality of instruction? How do we support professional learning? How do we lift the bar of who's teaching and provide developmental pathways to get teachers that represent students? How do we build systems that are more equitable? How do we remove a lot of the anti-bias or pure racist institutions? Like all of those things are things that we've got to solve. And so I guess I push to the research world, in a conversation I had with Chris, like you all are so focused on experimentation and methodology and the good science that makes you all who you are and defend yourselves against, true science. But I'm just wondering, like, can you pause a little bit on the science and pause and give us more support on what we know works and how to do it better and make sure that we have equitable access to high quality and that systems, federal systems, public systems, community-based, HHS with public schools and DOE, those systems really start sharing resources and leveraging one another. And then what is the science of supporting the policies there and the impact? So more focus on reality and less on like the best science, I guess. That's what I would say.
I was just going to jump in real quickly too and say that IES, so we're making recommendations for funding now, but the IES used to fund research practice partnership projects in the exploration phase. So having more of those opportunities where we're responsive and co-developing and responsive to partner needs, I think would be possibly one way to address some of these questions, and I agree with Amanda. You know, there are other opportunities where we've had in our work to be more responsive and provide feedback more to our partners in the service of research through other mechanisms that possibly could work in the future.
Okay, so I was pausing to see if anyone else wanted to chime in, but I think the things that Stephanie has shared, and Jason and you as well, Rebecca, just really is pushing, I think, the researchers, funders, and researchers to really rethink how we approach this work. And I really appreciate what you said, Jason, that yes, none of these, we had a broken system before COVID at many levels, and the things that you shared, Stephanie. I mean, yes, we have structural racism, we have structural inequalities, those things pre-existed before the pandemic. It just kind of, you know, it's like put a magnifying glass on existing issues that were already present in our society, and that in many ways we sort of glossed over even in the research and the work that was done in the early childhood space, right? A lot of policy and research investments, but not really looking at some of these key issues. So with all of that in mind, as we progress through this discussion, then I really want to try to shift the focus to think about what this means for future research, because I'm here representing a funder of research. So to really think about how do we try to create a more equitable early care and education system? And really it's maybe our system was broken, it was really deconstructed during this pandemic, and really think about if we're rebuilding something from the ground up, what would an equitable, high quality early care and education system that's going to meet the needs of the diverse group of students and children and families who are being served, what would that look like? And really, what is the role of research in helping that to become a reality? So sort of both of those things, sort of how do we rethink the early care and education system moving forward, what is the role of research and what type of research is needed, and maybe it's more researcher practitioner partnerships or something else. So I know I'm asking several different questions, but I think we can move to that. And Stephanie already touched on a piece of this as well, measurement. You know, we had the open and plenary session of the conference where the theme of the conference is focused on equity, but I was really struck by what one of the presenters said during their TED Talk this morning, that we treasure what we measure, right? And Stephanie, you made some really important points about the types of things that we have measured for decades in this field, and then say, oh, well, we don't have an understanding and we're not really figuring out what's going on with the mechanisms of what's going on with these children. And a big part of that is probably sort of just shortcomings in terms of what we're measuring. So that's something else as well. So I'm throwing out a couple different questions. One is to really think about what research is needed to help us to build and create a more equitable early care and education system, and what should we expect from that system? And then what are things we need to change around? It could be what we measure, who we measure, how we measure it. So there's measurement, but are there other things we need to think about as we envision that and think about possible research that would be helpful to you, Jason, and to everyone else in the field?
Oh, I'll go first, and this will be my last ones of the day, is that when I thought about this, one of the things that was compelling to me is just really, like, I like to say, like, remembering our roots, right? And rethinking of early childhood as building the long-term social and emotional skills and sort of health skills. So if we really think about peri-preschool project results, those long-term effects were really in the social and emotional realm of life. And that's even true for abecedarians. Those are the results that we're known for. That's the reason why people are investing in our field, or all these like social and emotional results. And instead, what we ended up doing as a field is that we became so preoccupied with the cognitive gains from those interventions, and that now we spend most of our time trying to measure these cognitive, sort of gains. And I think that we really just need to hunker down and to focus even more on sort of the social and emotional well-being, because that's what's really driving the long-term success of the children in these programs, and which really driving the long-term success of our field in general. And then, The second thing I would say is just really being open to new areas of research and really starting to think about this identity as racial, starting to think about things like racial identity development, as well as sort of racial stress and trauma, and really thinking about those as social and emotional skills that are worthy to be included in our batteries. And I think that we need to begin to bring this research knowledge into sort of our main battery of how we think about children and their development, and don't stop relegating it to sort of the outskirts of, of child development. And then lastly, I think that I think we need to diversify who is at the table when it comes to making these policy decisions, and also when it comes to making funding decisions. And so we really need to start to invest in scholars of color being at the table when these funding decisions are made, and when these funding things are being awarded.
I have a thought I can share related to the sort of future of research. I mean, all of us who have IES funding, when you read the RFP, everything is centered around the academic and social behavioral skills of children. And I'm all for that, of the students themselves. That makes a ton of sense. But I also like the idea of focusing on the teacher outcomes in and of themselves without having to make these links to the student outcomes. What I would appreciate is opportunities to do efficacy trials or to do development work on interventions and programs that are supportive of teachers, and that's it, of their mental health, of their well-being. Most of the theories of change that we're walking around with see the teacher as a passive participant, as a link in the chain of a mechanism to get kids to do better on a Woodcock-Johnson test. And to me, I feel like I would love to not have to make that argument. I think you can make an argument, well, teachers who are less stressed and less depressed are going to show up as being better interaction partners, and thereby it's going to have a good effect on the kids' academic and social and behavioral skills. But in order to really test that with enough power to find those links, you're gonna, I don't think the budgets are big enough for that. And so for me, we kind of secretly look at those sort of more proximal outcomes, and we even see those as almost, especially today, more primary than the academic skills that kids that we're really funded to support. So I would appreciate more of a green light, more opportunity to do research on teachers, teacher health, teacher well-being, all the things that we know support the kids, but maybe aren't necessarily going to show up in a big efficacy trial. So that would be one suggestion for new opportunities to be supportive in ways that we aren't.
Yeah, just to add on to that, I think there's a real need for more studies that look across Head Start, public schools, and childcare programs, especially those supported through the subsidy system. And the way the grants are structured now, there's really, you just can't get enough power to really look effectively across those settings. But I think it's by having to study them in silos, it's sort of making it harder for us to really illuminate the differences across contexts. Similarly, I think it's one of those things where we can't get enough statistical power if we look across settings, but at the same time, it feels like we have kind of a responsibility. The federal and state governments put substantial funding into all three of those early childhood contexts, and they largely serve some, very similar populations of kids. And in most places, in most state contexts, even public pre-K is still eligibility based. So, it would be really, I think, important for us as a field and from a policy perspective, just to really understand what are the differences when parents make these choices to opt into one program or another. I think we would all like to imagine that they're going to enter programs that have good quality and good support. And, really all three settings have somewhat different strengths. The childcare sector really provides ultimate flexibility for families. It's an critical support for families in terms of the hours they maintain for families. And, we usually think of the public schools as not having as much of a workforce support lens, but being more enrichment, but families use that as workforce support as well. And then Head Start, I think we we kind of talk about them as having the strongest family engagement component. So it's just interesting to think about if we could open up our research to looking across the settings, what would we find and what would we learn that lets us kind of leverage the strengths that's coming out of each of those program types.
Two, or do you want me to, I can wait if you want. Okay, so two. So Black and Latinx students and students with disabilities are, I'm gonna make up numbers, but let's say they're like 40% reading proficient by the time they're in 3rd or 4th grade versus 70%, 80% for their white peers. And so, there's the problem. How do we solve that? Preschool certainly is one piece, but the linkages between preschool, and I'm sure it's worse for math, or those discrepancies are even worse for math. And if we had a good social emotional measure, we might find that it was even the same disparities exist. So I think, what across systems, what professional learning is needed, what instruction is needed, and to focus on that, because that's what schools are really trying to do is get kids to read, write, communicate, and solve problems. And to the degree to which there's an alignment across systems and that there's continuity in curriculum, which there's not, and continuity in instruction, which there's not, and there's continuity in equity and access to quality instruction, which there's not. That's where I think we've got to do a lot of focus. So that's one. The second is, Build Back Better is about to say 3 and 4-year-olds. And so understanding, should we put all 3-year-olds in one room separately with the scope and sequence, or do we combine 3 and 4-year-olds? And then what's the impact of the different settings and understanding those things, because we're, in theory, going to have millions of children now having access to preschool in ways that we haven't before. And then how do they transition into the public schools? Kindergarten mostly is probably a reteach of pre-K. And so what are the systems across that need to happen? What do public schools have that community-based programs don't have, and vice versa, and understanding the linkages across those systems. And then in particular, I think we need to focus on students with disabilities. I think that often that research is put somewhere else, and mostly not looked at. And I think we need to have special additional funds to look at students with disabilities and the systems and structures that support them as well, because again, those are mostly Black and Latin boys who get put there. So I think that's another thing for us to pay attention to.
Thank you, Jason. Kelly,
yeah, I can jump in quickly. So a lot of really important points have already been made, but I guess going back to some of the things Andy said and that came up on others, I think at a minimum, I think we need to understand how context and systems are shaping the research findings that we're getting. So you can have the best PD program in the world, but if 40% of the teachers are turning over during the year, is that really going to make a difference for the kids in the classrooms? Or if you have a great curriculum, but kids aren't there to experience it, is that going to make a difference? And so I think at a minimum, we need to think about making sure we're capturing these things in our studies really well. And that may be things like teacher mental health. But I also think moving more the direction that Andy was talking about, actually building things into our studies that could improve context. So in addition to improving teaching practices or curriculum or things like that, how are we changing the larger context that teachers, assistant teachers, and kids are experiencing in the day-to-day, I think is going to be really important for us to have systems that are working for kids and having them, and systems that are going to start to hopefully reduce some of these inequities that we've been talking about.
Any other thoughts from any panelists before I try to summarize a few of the things you've shared and then open it up there? I see there's been lots of activity in the chat, so I'm glad this has been a good way for folks to virtually engage with each other, even though we can't be together in person. But any other thoughts before we open it up for a discussion with the attendees?
I just
And I
have
see
something
there's some
brief,
questions.
just something brief to add about the research practice partnership side of this. I think it's, really been interesting as I've talked to partners. There's a lot of federal and state and even local and philanthropic investment that's going into schools right now. And what's really interesting is, they're making a ton of choices about how to spend those dollars, and they're making those choices quickly. And I think what's feeling like a potential misalignment is, speaking for myself, I tend to like to test interventions that I've developed, or co-developed with someone. But what I'm sensing with partners right now is what they could really use, I think, is an opportunity to have those programs that they're choosing right now be tested and evaluated in a high quality way. So it's a different conversation. I think it's going to be interesting to see if we can find ways to help them evaluate, so we can quickly start to disseminate, what's working that's coming out of all of this massive investment. But it might mean setting aside some of the things that some of us typically would be proposing and studying in service of that goal.
That is a great point, April. I think we say we fund IES, we fund field initiated research, but in reality, what it usually is a researcher has an idea or something they've developed or that they want to develop or measure, and that's what we're funding. And it's a different focus to really shift our thinking to what do the practitioners actually need? What are questions that are going to address their needs, and to really see how we can better align the research with the field, right? So it's field initiated in that sense that it's actually being responsive, especially thinking about the early care and education field and where we are in this moment, something that's much more responsive, right? So some of Jason's points about, okay, if Build Back Better is on the horizon, what kind of research or research findings would we need to really inform how that gets rolled out and implemented? And you've all, made excellent points and shared some really concrete ideas about what we need to think and rethink in terms of what we measure, what we define as a social emotional skill. So really thinking about things, for example, like racial identity, and really expanding our definition of what child development is and looks like, and what healthy child development should look like, and really making sure that we have measures that are actually in alignment with what that definition is and really what the needs are. They were always there, but even more so in this moment. And as we try to re-envision our work and the work in this field moving forward, that it's a great opportunity to implement a lot of the suggestions that you've all just made. And I hope for attendees, I promise we're going to turn to you now and try to answer some of your questions. And if you have any thoughts you want to add as well, you can chime in. But I hope this session so far has been helpful to you and just really trying to see the full range of the complexities. We started with talking about the challenges, but I appreciate, Stephanie kind of led this by saying there are also opportunities, right? So yes, there are many challenges we're facing as a field, but we can also think about it as an opportunity. And I think it's a great opportunity to think about, I certainly support all the suggestions folks have made, both in the chat and comments around the researcher practitioner work. I think that's critical, again, to really trying to do relevant field initiated work that's going to be responsive to questions, that's going to answer questions that are going to meet timely and important needs for early childhood programs and even in the K-12 space moving forward. So I hope you've taken away some good ideas and thoughts from the session so far. Just for yourself, maybe it's comforting to know you're not in this alone if you also have an early childhood project that's in some stage of completion or incompletion because of the pandemic. But even more that this really the topics and the issues that were raised are really an opportunity for you to rethink your work, both the work that you're doing right now and any future work or research you're proposed in light of the conversation we've had so far. So with that, I'm going to open it up. There are a lot of comments in the chat, not necessarily a lot of specific questions. So I will scroll through and try to find some of these that are actual questions. But while I'm doing that, if there's somebody who has a question and you want to raise your hand or come up, unmute yourself and ask, we can start there while I scroll through the chat to see what's going on. No one? Okay. Then I'll try to pull up some of these questions or comments here. So I think there was a question earlier while I'm going through. Someone asked for the folks whose projects are on hold, sort of how you handled budgeting and what you did or what you're doing during these pause years. So if Andy or Kelly or April, if you want to address that, I will pull some other questions from the chat while you're addressing.
Yeah, that's a really good question. And I appreciate it because it shows that, the research team is part of the, impacts of COVID as well. And so that's been my challenge for the last 2 years. Currently, my research director is on half time to, work with data that we've gotten that begin to sort of recruitment right now. My implementation director is laid off. There isn't work to do right now. She was able to find another full-time job temporarily. My hope is that come next month at the beginning of March that she'll be back here. I'm beginning the hiring processes, but it's taken a real toll on my team, both in terms of that security, but also their identities are making the world a better place. And it's just been really hard to privilege the research above the implementation. We're funded by the education research group, and so it feels like we felt threatened if we implement and can't do our research. What will the impacts be on our project? And so I would say, in addition to the sort of insecurity and uncertainty of the positions, that's been a major thing, is trying to get my team together, feeling like they're connected to the world to make a difference, because that's who they are. They're doers in the world. And so some of the thinking and the process of research that has slowed them down has been just really hard at the day-to-day level for them to feel good about things, because they're not out there making a difference.
Yeah, my experience was really similar. It was, especially in those first few months, it was a real source of stress on top of everything else. And some of our field staff was able to find other types of work at our center. After the first year of not being in the field, my project director took another job, in part, I think, because of some of the things we were talking about, Andy wanting to have something that was really making a difference in the moment. And so I'm now looking and starting to cope with the fact that I have to basically hire a full new project team this spring and to be ready to go in the fall and really start from scratch on that. And so I'm thankful that everyone was kind of able to find the employment situation that they wanted throughout this. But it also means a big lift in terms of training this summer.
Yeah, it's been similar for us. We've been on full pause, in terms of budget since the spring COVID hit. And we were really fortunate to be able to see our staff move into other service programs and initiatives in our institute. But it also means that, I'll get some of that interventionist and research time back from staff, but not all of it. So there's a lot of rebuilding to do when we restart.
You are not alone in that. So thank you all for that. There's another question in the chat asking what have been the implications of the pandemic for disciplinary practices? This person says, I'm part of an intervention to reduce racial disparities in discipline in K-12, K-5 classrooms, and we're trying to figure out just what the current practices are. So anyone want to respond to that?
I don't have a response on the disciplinary actions per se, but as part of, not through kind of my IES funded work, but as part of our research practice partnership with the Virginia Department of Education, we do collect statewide data on children's self-regulation, social skills, and mental health skills via teacher report. And interestingly, on those aspects of kind of self-regulation or self-dysregulation, we actually saw a reduction. So kids looked better on some of those, not on mental health. So teachers were reporting more issues around kind of anxiety and depression, but less issues around aspects of kind of aggression, verbal or physical, or things like that. And I do think, like, again, it's this idea of like the context for children is very different. So kids have masks over their faces. Kids aren't allowed to kind of work together on things. They're doing much more kind of independent at even very early ages in preschool and in kindergarten. They're spending a lot of time on asynchronous, like on their computer doing activities that kind of has what children do in classrooms kind of has changes. And I will also say that for many families who are in virtual and their children may have had kind of ADHD or something, like they were like their kids weren't getting in trouble anymore. Like, and so there is an aspect of kind of thinking about how the context just kind of changed those things, right? Like your teacher can't give you, exclude you from the classroom as easily if you're kind of on kind of if you're in kind of virtual. So, and then I know there are also aspects of like, you know, racial discrimination and exclusionary discipline practices due to race were like, you know, those practices also shifted when kids went virtual. So.
Anyone else want to address that question? Thank you, Amanda. Oh, okay. So there's another question in the chat asking how people are handling comparing pre-COVID cohort.
What do you do when your facilitator is frozen?
It's the good question. Someone can read, right? What is whoever's question it was, unmute yourself and ask it.
I bet it was comparing pre-COVID and post-COVID cohorts.
Yeah, I'm reading it. How are people handling comparing pre-COVID cohorts versus COVID cohorts? But we can say pre versus, there's no post-COVID yet, right?
I mean, we're still working through it. Because we took the year off in our efficacy trial, we're just now in the field with our post/during COVID cohort. But I think I saw someone else in the chat talk about running cohorts separately, and I think we'll certainly have to do that. But it is a challenge because, you know, we're powered to look at it all together. We're not necessarily powered to look at cohorts individually. And so I think it's gonna, you know, I can't imagine that we wouldn't look at it individually, but I think we're also going to have to look at it in the context of that's not what we are initially powered to do.
I just have a comment about what kids experienced in the last 2 years is not normal, and where they're at is not the norm anymore. Maybe it's the new norm, but I just think the expectations that teachers all taught a certain way and children all received the same is just not there. There's so much variation that you'd really have to have a good handle on that, in my opinion, anyways.
Agreed. Yes, I think it's very difficult to try to do that comparison given how much circumstances have changed. Okay, I'm just scrolling through the chat to some of these are comments, some are questions. So if someone has a question and you want to just unmute yourself or a comment, please feel free to jump in, because I'm just trying to make sure I'm addressing questions, but I'm also, a lot of these are comments from folks. So Erica Greenberg asked, first of all, thanks to everyone for sharing about your research pauses. And so her question is, are there additional examples of research pivots in terms of study design, data collection instruments, analytical methods, et cetera, due to the pandemic? And of course, I'll open it up for folks, for the panelists to answer, but I know there are also other IES-funded researchers in this session. So if any of you want to jump in about sort of changes or adjustments you've made to your project, feel free to do that as well. So
I can give
anyone
you-
want to address that?
I can give you one example that we did with MDRC. We use Seesaw, which is a platform for teachers to put assignments remotely. And it was actually the first time I could see every classroom, every assignment, kids' work, and then teachers' feedback to that work. And it was actually for a principal's learning session, because I thought it would be interesting to give principals feedback about systematically what their teachers are doing compared to the district. And so we work with MDRC to actually code like how cognitively demanding the task was, how much feedback they got, and various other things. But basically just looking at who did the assignment, how many were completed, how on a complexity of cognitive demand the task was, and then whether or not the teacher actually gave feedback to that child, and whether or not then there was revised and resubmitted something, kind of just looking at that interaction. And we found it really low, both the tasks that they were given and then the amount of feedback kids were given. And then also, like when I used the number about 40%, it was roughly about 40% completion. Now, it could have been the nature of our task and the assignment and how people were using the remote platform, but it was insightful to like have that research and start having those conversations with principals right away. So there's one where we were able to quickly come up with a coding scheme, and the MDRC staff actually did the coding for us. And it was useful for principals to begin to think about, So that's one example. And then I think another is just as a staff, we really started focusing on restorative justice work with ourselves. And a lot of issues around race, institutional bias, white supremacy. And I think that work then influenced the markers that we want to use to hold ourselves accountable and our work accountable. So I would say those are kind of two pivots that happened internally as examples. But I think that everybody could come up, well, maybe people could come up with other ones as well.
Thank you, Jason. Those are great concrete examples. Anyone else want to speak to this question or respond to this question? Maybe I'll reframe it a little bit to say, are there things you think you will want to change moving forward? I know you folks mentioned like different outcomes and other things they'd like to measure, but are there specific things, whether it's in your data collection approaches or measures or things that you would want to add or change, given everything else that's changed in the past couple of years?
So Caroline, sorry, April. I was just thinking across, I think about my kind of IES-funded grants, which is both kind of an efficacy trial, which as we've talked about, there are just certain constraints around what you proposed and what you have to do in order to kind of meet the metrics of an efficacy trial and how that's different from a development kind of work. And then I also think about like research that I have happening on kind of like with the William T. Grant Foundation or other places, and then also kind of work. And I think, I've had different people tell me around whether this work is actually research or not, but our engaged kind of scholarship work with the Department of Ed, where some people call it research and some people call it service. There's just different levels of flexibility. And so, in some of the work that we've done with the state, it's been interesting, and it kind of relates to something Jason said earlier, like, we could pause what we were thinking of as our research and just pivot very quickly to what our state partners wanted us to kind of do. So for example, like, we were planning on doing a certain part of coaching, and we would have survey and data collection related to that, but that wasn't going to happen. And they were like, hey, you know what we really want? We really want to know the answer to this question. And you guys are good at distributing surveys. So how about next week you distribute a survey to answer this question for us instead? And we were able to kind of do that and pivot, and that kind of changes the pace of the research. It also maybe changes what you're doing. I would argue that it is still research and it is still scholarship. But we do have kind of institutions that that make it harder to have that kind of work acknowledged in the same way. So, and so I appreciated that flexibility because it kept our staff working, right? We could keep our staff employed and we could keep people working. They were just doing different things. Versus I think sometimes, we have an efficacy trial to test a mental health consultation and we need to be able to do that. And so whether or not in this context we'll be able to do that, at least as we envisioned in COVID, I feel like has less degrees of freedom. And then we were doing an implementation study that was funded through some foundations. And that was also really interesting because we actually kept that implementation study going through COVID, but we had to do all kinds of adaptations. So, we had to take this comprehensive birth to 5 curriculum and we had to change it week by week and make it applicable for the centers. We were in kind of private and public programs. Some places were virtual, some places were in person. So we had to week by week kind of adapt that curriculum so that it could continue to be delivered, but we could do that and still continue to kind of implement it. And interestingly enough, we found that like engagement of educators with their coaches was incredibly high even throughout the pandemic. So, I love kind of having that flexibility, but it depends upon the questions that you're trying to answer.
It depends upon the nature of the work, but I would agree with you.
Yeah.
I mean, all of that is research and very much field initiated. So I've been told to let everyone know that we're out of time. And so Katie, I don't know your last name, you had your hand raised. My apologies, we didn't get to your question. Thank you all for attending the session and thank you to all of our panelists. This was a really great, rich discussion and hopefully all of the attendees got a lot out of it. And the commissioner has been here, so she's heard all of the thoughts around flexibility with the research, Liz, and partnerships and other things. So I'm sure we'll do our own sort of internal reflection and really think about a lot of what's been shared today and how we can improve the work that we're trying to support. So thank you all. Enjoy the rest of the meeting. The next session's at 4:30 if you're staying for the next virtual session.
Thank you, Caroline. Thank you.
Thank you all.
Thank
Thanks
you.
all. Thanks, you guys.
Bye.
Did a
Thanks
great
for
job.
inviting us.
Bye.
I know.
Thank you.